Dr. King and I, we are part of American College of Obstetrics and Gynecology, and they used to have all these definitions of how many milliliters or teaspoons. And I think ACOG has generally jumped to patient perception, which I love. So if a woman or a teenager feels like her bleeding is heavy, then it warrants being investigated, and it's abnormal. If we have to look at numbers, because some people really like to measure that way. My 11-year-old asked me, for a period app. And so I gave her one so she could keep track of the days she was bleeding and the interval between cycles. You don't want to bleed more frequently than every 21 days. And we count from first day to first day, not from end to start. Typically anywhere from 21 to 42, or there's different books that will tell you different things. For me, I tell people if you're bleeding more than a pad an hour, or if your pain or cramping is not resolving with over-the-counter Tylenol, heating pad, Motrin, Advil, then those are all signs and symptoms that something's wrong. Very, very large clots, not normal. Some women can pass clots, when you lay down and you sleep, obviously the blood is going to clot. You can wake up in the morning and you can pass clots. But very large clots, feeling dizzy, obviously, like Dr. King referred to, being anemic, like those numbers she threw out, none of that is, normal or typical. And so those are all signs that it needs to be addressed, especially the pain. So those are things that definitely warrant a call to an OBGYN.